Millions of us go in for routine surgeries every single year, things that have nothing to do with the heart. But there's this hidden danger, a really serious complication that often gets overlooked, and it has absolutely devastating consequences. Today, we're going to dive into that hidden risk, acute heart failure right after surgery.
Okay, so I want you to just look at this number for a second. 44%. In the world of medicine, whenever you see a number that high, it's alarming. So what do you think it is? What could it possibly represent? I can tell you right now, it's not a success rate. No, it's something way, way more serious.
Yeah, that's the one-year mortality rate. Let that sink in. A staggering 44% of patients who develop acute heart failure after a non-cardiac operation don't make it through the next year. This is a massive hidden danger, and we absolutely need to be talking about it.
All right, so here's our game plan for this explainer. We're going to break this whole thing down. First, we'll look at the scale of the danger and what exactly surgery does to put the body under so much stress. Then, and this is key, we'll get into prevention. We'll talk about patients who know they have heart failure, and then the bigger challenge, finding those who don't. And you'll see why, in the end, it all comes down to preparation.
So let's start by really putting this into perspective. Just how dangerous is this? I mean, how does getting acute heart failure after surgery stack up against other situations?
This chart really tells a story, doesn't it? Look, a patient with no heart failure history has about a 9% risk of dying within a year after surgery. Okay, that risk more than doubles to 21% for someone with stable, chronic heart failure. But then, look at that jump. 44% for a patient who develops acute heart failure after the surgery. It's just a staggering leap. This is not some minor complication. It's an absolute life-threatening emergency.
So why? Why does this even happen? What is it about a standard operation that can literally push a person's heart over the edge? Well, it all comes down to the body's really intense reaction to the whole process.
You see, surgery isn't just a simple mechanical fix. To your body, it's a major trauma, and it kicks off this massive, system-wide stress response. First, you get this flood of hormones like adrenaline, which just spikes your heart rate and blood pressure. Then, the immune system fires up this huge inflammatory response that can actually weaken the heart's pumping ability. And to top it all off, your body's clotting system goes haywire. For a heart that's already a bit vulnerable, this perfect storm of stress can just be too much to handle.
And that brings us to the most important part. What can we do about it? How do we protect people? Let's start with the folks we know are at risk, the ones who already have a heart failure diagnosis. For them, it is all about meticulous, careful preparation before they ever see an operating room.
We really have to think about this problem in two separate buckets, right? On one side, you have the patients with a known diagnosis. For them, the strategy is all about management, about getting them into the best possible shape. Then you have the other side, patients with no known heart failure, and that's all about detection and discovery. So let's focus on that first group for now.
With patients who already have a heart failure diagnosis, we can actually put a number on their risk. We can use tools like something called the Anderson score. It looks at all kinds of factors, age, other health conditions, to predict the chance of dying within 30 days. And the risk just varies wildly, from less than 2% for people with a low score to over 50% for those in that highest risk group. This gives the medical team a really clear, data-driven picture of what they're dealing with.
And that risk score isn't just a number. It leads directly to a pre-op checklist. The team has to assess the patient's symptoms, often using a scale that grades how severe the heart failure is. They've got to make sure the patient is on the absolute best medication regimen and that their fluid levels are stable. And here's the critical part. If a patient is unstable, let's say they have severe symptoms even when they're just resting, then any non-emergency surgery has got to be postponed, period. You wait until that heart failure is back under control.
Okay, so managing known risks is one half of the equation. But what about the other half? This is arguably the bigger challenge, finding the danger that's hiding in plain sight.
Now, this statistic is genuinely shocking. About half of all cases of acute heart failure after surgery happen to people who had no idea they had heart failure to begin with. These are called de novo cases. It just means there's this huge population of at-risk people walking around completely unaware of the ticking time bomb in their chest.
So that's the million-dollar question, isn't it? If the patients themselves don't know they have heart failure, how on earth are doctors supposed to find it before it's too late? The answer, really, is active surveillance. You have to go looking for it.
And that search starts by looking for red flags. We know that certain things dramatically ramp up the risk. Things like advanced age, a history of heart disease or diabetes, lung issues like COPD, or even anemia. And of course, if someone's rushed into an urgent or emergency surgery, the risk skyrockets because there's just no time for that careful, deliberate preparation.
So when those red flags pop up, the medical team has to dig deeper. This means actively asking about subtle symptoms that an older patient might just brush off as, just getting older. It means using simple tools like an ECG, doing blood tests for specific biomarkers. These are proteins the heart releases when it's under stress. And if those tests raise any concerns, then an echocardiogram, which is basically an ultrasound of the heart, can give a clear yes or no answer.
So as we pull all of this together, one idea just becomes crystal clear. The absolute best way to treat this deadly complication is to stop it from ever happening in the first place.
I think this quote from the European Heart Journal just says it all, perfectly. Of course, being vigilant after surgery is essential, but the real battle, the one that saves lives, is won before the surgeon even picks up a scalpel. A thorough, proactive, pre-operative evaluation is paramount. It's everything.
And really, this brings it all back to you. We've seen just how critical this preoperative preparation is. So as you or maybe a loved one gets ready for surgery, probably the most important thing you can do is make sure the right questions are being asked about heart health beforehand. Because knowing the answer, well, that could make all the difference in the world.